Doc, we're talking about Sinovac, may EUA na, papasok na, but maybe you could help us to understand this because, FDA has pointed out Sinovac data shows 65 to 91% efficacy, but they're also citing, Dr. Domingo, Yusek Domingo is citing that in Brazil, trials involving healthcare workers 50%, 50.4% efficacy lang. Now, tied in with that is government's clarification, pagpasok ng Sinovac, explicitly, it will not be for healthcare workers. What exactly is the concern here? Bakit po hindi ibibigay sa healthcare workers?
Okay. Now, if you look at clinical trials like the Sinovac, there are 3 sites here. The Brazilian study was the one that was initially completed. And yung mga participants dito are high-risk healthcare workers. And they are the ones seeing COVID patients every day. Now, if you compare the 50% efficacy, so that only means that you still have a higher 50% risk of getting the infection. And in fact, your risk there is already high. You'll be getting this vaccine. So that's an example of how we should position vaccine based on the efficacy and the target population. And that's really important when you look at efficacy and the target population. Now, in the Turkey and the Indonesian trial, these involved non-healthcare workers, or in fact, if there were healthcare workers in the Turkey trial, they are still the high risk, but number of participants were low compared to the general population. So which means you have a higher efficacy rate in the general population compared to those with high-risk healthcare workers.
Doc, you're an infectious disease expert. Very quickly, baka maybe just explain to us, bakit po yung iba yung efficacy dito sa mga high-risk, highly exposed medical workers versus the rest of us?
Yeah, because that's how the vaccine works. No, it has several different efficacy in a different population. And in this particular study, they found out that the efficacy among these high-risk healthcare workers is really low. We have to accept that efficacy rate. And that's the beauty of a phase 3 clinical trial. You'll be able to know and look at how effective or how the efficacy of the vaccines in different target population.
Hindi ba yung efficacy is dependent on the level of is it dependent on exposure? Hindi ba depende yun sa infection? I mean, some vaccines work better in severe cases, yung iba mild cases. Hindi ba yun yung hindi yung sa risk? Hindi ba sa risk yun?
The primary objective of the trial here in most trial is how effective this vaccine in preventing any symptom of COVID. So regardless of mild, moderate, and severe, nandun yan, kasama yan. And then they will just do a analysis if how many of those were prevented from getting the severe COVID or the moderate COVID. But the 50% is the overall efficacy. In the Brazilian trial, all of the participants are healthcare workers who are seeing patients every day. Okay? And that alone, the 50%, that's the overall efficacy. So for me, I don't think that's quite a low vaccine efficacy for it to be given in the health frontline workers who are seeing patients, COVID patients a day.
Doc, you're saying, Bale, that efficacy is also a factor of exposure to the virus. It's not necessarily a factor of severity of the illness. Tama ho ba?
No. Efficacy is a factor of how our body produce an immune response to a particular infection. So meaning, out of 10 given the vaccine, and the other 10 did not receive the vaccine. In this particular study, they found out that 50% of those who were given the vaccine did not develop, and 50% of those who did not receive the vaccine 50% they did not develop. So mukhang merong 50-50 ang efficacy niya.
Doc, we're asking this because also, we are also mindful that pagka lumabas to sa balita, as it already is now, people will be cynical about it. They will look at the 50% being reported and so on. But one of the bottom line things that people need to understand at this point, if I'm understanding this correctly, is if you qualify as a candidate to receive the first shots of Sinovac, you're not talking about a 50% efficacy. Your chances are actually 65 to 91%. Yun yung numbers na pwede mong panghawakan.
Yes, that's for the general population. So these are the low-risk population, meaning they're not seeing COVID patients a day. Ganito kasi, explain lang natin for konti, no? Pag ikaw yung frontliner and you're seeing patients a day, yung risk mo, seeing patients a day, siguro 50 to 60% you'll be getting COVID. The first time, second time, third time. But if you're in the general population not working in the hospital, your risk is really lower than that of the healthcare workers. Now, in this particular study, the risk for those with high risk of getting COVID is only 50%. Those with low risk of getting the COVID is higher. So, ilagay natin doon kung saan siya mas mataas ang efficacy.
Okay.
Okay, so you think that this is a fair deal to give Sinovac to the general population and not to the health workers? That's essentially what you're saying.
Yes, yes.